Welcome back to Think Talk Laugh here on 55 KRC, the talk station. We are glad that you joined us today.
We're going to tell you about some things that are going on behind the scenes, already in progress, that will allow you at home to get the services of the finest physicians in this country.
But I always think back to a commercial that if you've seen the commercial where the guy's on the phone with the doctor and the doctor says, okay, take the knife, count down 3 ribs and make an incision there. And the guy says, well, aren't you the one supposed to be doing this?
Already have services like this in full-blown style.
Actually, it's funny you asked that. Yes, they do. And we're going to be talking to an expert in the field who is running a telemedicine company today.
And once again, we're proud to be Americans because I think the U.S. is probably leading the way in telemedicine.
I think we are.
Lou Daniels, how are you?
Thank you for having me.
We're excited to have you because I know a lot of people out there don't know what telemedicine is.
Over the last couple of years, we've been reading so much about healthcare and all the changes that are going to be going on. With 37 million uninsureds coming on the insured rolls over the next couple of years, it became apparent to me that was going to become the gatekeeper for affordable care, for access to care. And that's going to be the key, and that's probably where our conversation is going to go quite a bit, is how are people going to access care? Because the way our doctors work, our protocols are set up so that they're asking the right questions on the phone. Is he's able to go through his protocols, he's either going to be able to say, you have to get to the emergency room right now, or, you can wait till tomorrow, either see your doctor or go to urgent care. And that's how our doctors identify it. But it's really for the softer issues. The statistic is that 77% of all emergency room visits are for non-emergent care. And, maybe we could fast forward, but because I always thought it would be heart attack, broken bones, or maybe a gunshot wound. In fact, the top 3 reasons from the AMA is ear infection, number 1, sinus infection, number 2, upper respiratory, number 3. So those are 3 items that can easily be diagnosed by a doctor. They can say to you, your prescription's waiting for you at your 24-hour pharmacy. And you give them permission. They're allowed to go into what we call SureScripts, which gives some type of background on the type of medicines that you've been taking. So they line up the medicines that you've been taking in the past with what they're seeing. Typically, they're going to be able to say to you, I see that you've had sinusitis a couple times, or you've told me that you have sinusitis a couple times, and I see that the script that you've taken is X. I think we're going to try that again. And what happens with telemedicine, there's a 72-hour immediate follow-up. So you're not going back to the doctor's office. Our health advocate is calling to see if you're well, you're improving, is the medicine working? If it isn't, then we're going to change things up. With consulted doctor, we typically get a doctor on the line in 90 seconds. You don't get a nurse, you don't get a receptionist.
I love that.
You have to remember that we're actually a technology play. So what we're reading is we're reading your area code, and that's why we have such a great level of doctors in each state, because we begin to ding the doctors that are on call for that time period to see if they can pick up the call.
If I'm diabetic and I need to know something, to communicate some of that maybe data that you already have internally from some of these home health devices to these doctors?
Not really. I mean, but I will tell you that the technology is changing, that if you wanted to, from our company, you could purchase a mouse for your computer. On the mouse, there's a little sleeve that you can put your finger in, and so when you're talking to the doctor, he can pick up blood pressure, he can pick up pulse rate, and he can even pick up temperature.
Oh, wow. Well, once again, thanks for listening. This is Think Talk Laugh, LAF, on 55 KRC, the talk station.